How are you?
I'm great and yourself?
I'm good. I think I hear echo, or do I
Really?
not? Maybe I don't. Okay. All right. Can you tell I'm not ready?
Uh, no, not at all.
I'm like, oh, let me send this. Oh, let me do that. Oh, let me get this together. Oh, good morning. Good morning. Happy Saturday.
Yes. And happy MLK weekend.
Exactly. MLK. You know I was going. MLK weekend. Oh, yes, yes, yes. Oh, I gotta look for some MLK posts. Good morning, good morning. I don't know who the LinkedIn user is, but good morning.
Good
Welcome,
morning.
welcome.
Welcome. Yes.
Okay, let's get this party started. Did you sleep well?
Yes, I did. How about
Good.
you?
I tossed and turned. Look, I felt the rep coming, but I let it go.
Ah,
Oh, but I'm okay. I'm okay. All right. So, welcome everyone to our Saturday morning tea, where we discuss health information, news, education, certification tips, entrepreneurship, all kinds of things that are going to come down in 2024 and the revenue cycle at large. And as you come in, don't forget to hit the thumbs up or like button. And as one of the ministers of my church says all the time, be an inviter. Invite somebody. Share this video with someone. So I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance in education. Now, let me ask you, do you know what it takes to be a certified, marketable medical coder? Yes, you hear my emphasis, marketable. Well, before I introduce my co host, let me share with you some information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. Hey, okay. I love it. I love it. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, feel free to check out the video description for the link. Joining me today is my illustrious co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare for a very long time, 3 decades. In 2014, I transitioned away from the bedside into HIM, and in 2020, I created a company called the Coding Nurse LLC, where I help nurses and other healthcare professionals with a clinical background transition into the wonderful world of HIM.
And how is all that going?
It is going great. I had a new class that started last week. We completed our first week, and we'll see how it goes.
I'm sure, I'm sure it's gonna go well. Oh my god. Oh my goodness. Well, good, good. So let me remind you that this is a conversation. We bring the topics, but it's a conversation between um, us and you, and even us and between ourselves and having you be part of that conversation. So don't be shy. Join us. Join us. You can join us by placing comments in the comment section. The one thing that we ask is that you put a Q first so that we know it's a question, because you can ask questions as well. And to make sure that we don't miss it. And remember that your opinion matters and is welcomed here, even if it's contrary or if it's what they call it, an unpopular opinion. It still matters. So you are free to share all of those things. So for those who are joining us or watching the replay, today we're going to talk about navigating the alphabet soup of health information credentials. Yes, y'all have seen them all before. Wait a minute. I love this. Come on, trademark. Exactly. Trademark. Good morning, Renita. Good morning. Okay. Yeah, so we're going to just kind of do a walkthrough. We had an ask last week to kind of take a look at some of those credentials. I see my thing is my internet is looking funky, but hopefully everything is still going. It's going up and down, up and down, up and down. But we still hanging in. Okay, now it's gone away. I don't know. But anyway, so we want to take a look at some of those. But first, before we get into these health information credentials, we need to take a look and a listen to our church. In the background and I can still talk over it. How about that? Okay, so our church announcement for today. First and foremost, let me just say, hey, Dr. Campbell, how are you? How are you?
Happy New Year, Dr. Lisa.
Happy New Year. Happy New Year. So let me say, first and foremost, on our church announcement today, I think I could share this. Yes. Okay. So here, in Ohio, we're not letting this go. As you can see, we're about the no, about that no life. No on the 40% AHIMA requirement that your education should come directly from AHIMA. And so there is a petition that is going on. I'm showing you the AHIMA or Instagram page, but I think I put it somewhere. I think it's in the description box as well. Let me see if I can put it. Well, if you go to the AHIMA website, ahima.org, we have a blog spot that actually has the petition. So it's open to everyone. You can sign the petition that you are opposing AHIMA's 40% requirement for education certification. And it's real easy. All you got to do is put your name, I think your name, an email address, and you're on the list. I think I went out there yesterday. There were roughly 370 something or other folks who had signed the petition, and this just came out a couple of days ago. So not only is the letter writing still in play, but we also now have this petition. So if you are opposed to that 40% requirement of getting your education solely, or you are opposed to the requirement that's in play in 2025 of having to get 40% of your education from AHIMA, sign the petition. We welcome you to sign the petition. So and let them know, we can let them know with this petition. We can also let them know with our dollars that we're not for it, and we're not having it. We're not going to take it. I feel like Dave Chappelle. He said that in his thing. Okay. The other church announcement that I had related to, did you know, we've been talking about providers for a while, but providers, not only are the hospital systems kind of picking up providers and employing them, but did you know payers are in this game as well? So Optum, who employs about 90,000 physicians, who is part of United Health Group, is actually the largest employer of physicians in the United States. And we only, 13 days into 2024, and there are several plans in the work to acquire some of these physicians. Elevance Health plans to acquire Paragon Healthcare. That's a company out the Plano, Texas-based company, has more than 40 ambulatory infusion centers in 8 states, serving more than 35,000 patients on site and in their homes. Evolent said it will expand Paragon's geographic footprint after the acquisition. United Health Group's Optum is seeking to acquire physician-owned Corvallis. It's in Oregon. It's a clinic which operates 11 locations and an ambulatory surgical center in the state. The Oregon Health Authority is reviewing the proposed deal. And then Optum plans to acquire home health provider Amedisys. The deal announced in July is still pending, and a majority of the Amedisys shareholders approved the deal in September, but is facing scrutiny from the Justice Department, which requested additional information about the proposed merger in August and extended the waiting period for the deal under federal law. Now, Cigna was also in the news, in the game, talking that they don't necessarily need to own primary care providers, and they talked more about how these payers are scooping up providers. Their preference is to partner with the provider group, so they're still in the game, but they're just doing it in a little different way. And so they're talking specifically how they don't feel like they need to directly employ the primary care physicians. They don't have to own the clinic. None of those things. They just want to partner with them to bring about the best health outcomes for all. And I don't even know, they couldn't really even get this story off the ground without being asked about a rumored merger between Humana and Cigna that fell through in December. So they didn't want to comment on it, of course, but they don't know whether or not that one is still in the works. But who knows? But it was interesting to me to see, and I know we've talked about several times how all of these hospitals are acquiring these physician groups and physician practices. But look at here, the payers are right in step with them as well. So, Mr. Jesse, I didn't know if you had any comments.
It's just interesting. I would love to see how this ultimately plays out, because a lot of physicians are not happy with the current model. So this is going to bring about some sure enough change, because if you have people fighting over you, then that means you have a service to offer and you have some leverage. So we'll see how it plays out.
I agree. All right. So let's get into the get of today's topic. Wait, let my music go. Okay. Okay, so we want to talk about the various certifications that each of the organizations have. And I wanted to also, before I got to that, let me see, open this up, show you one more thing. So a while back, a long time ago, in my early broadcasting experience, I did a video, and I think I added the video to, I think I've added the video to the description box, but I did a video on what's the difference between AAPC and AHIMA. I used to do a segment called FAQ for You, which was quite popular. I just stopped doing it. I don't even know why I stopped doing it, but people will ask me questions, and those questions would become an FAQ, and then I would do like a short video regarding that. So if you want to know more information about the two players that we're going to discuss today, AAPC and AHIMA, feel free to check out the link in the description box. It's definitely in the YouTube description box to get more information on that. Okay. Goodbye. Let that go. Alrighty. Now, we're going to first start off with these AHIMA certifications. And we talked about AHIMA before. AHIMA stands for American Health Information Management Association. And AHIMA is the oldest of the two organizations, and they go back years, a century or so, where they started with the little medical record librarian who, like nurses of back in the day, used to wear the little hat. No, I'm kidding, they didn't wear hats, but you know, they would sit at these little desks with gazillions of little papers and pens, and documenting and writing all this information down about patients. Fast forward today, you know, everything is electronic, but they were in hospitals. Primarily, these positions were part of hospitals, and they learned kind of on the job, but they came up with certifications to set themselves apart in the hospital realm. But they have since spread their wings to all different types of health information credentialing, and so we want to talk about them today. So the first one that I'll bring to your attention, that folks give you the the side eye, is the CCA. And so the CCA is for coding professionals who hold the CCA. It's a certified coding associate. Coding professionals who hold the CCA credential have demonstrated coding competency across all settings, including hospitals and physician practices. Since 2002, the CCA designation has been a nationally recognized standard of achievement in health information management field. CCAs exhibit a level of commitment, competency, and professional capability that is valued by employers. They demonstrate a commitment to the coding profession and distinguish themselves from others as having passed AHIMA's rigorous CCA exam. To be a candidate for the exam, you must have a high school diploma or equivalent. While not required, at least one of the following is recommended. You need either 6 months coding experience directly applying codes, completion of an AHIMA approved coding program, or completion of other training programs to include anatomy and physiology, medical terminology, basic ICD diagnostic and procedural, and basic CPT coding. So that is the CCA. They have some data here on the pass rates. I think we talked about this last week For CCA in 2023, the number of first-time testers were 2,445 with a 70% first-time tester pass rate. And they've been kind of consistent with that rate. The highest was in 2021 at 74%, and then it's leveled to 70%. The CCA is also a time test. Candidates have 2 hours to complete the exam. The total number of questions on the exam is 105, and there are 90 scored items and 15 pre-test items. And the exam is given in a computer-based format. Mr. Jesse, any comments on the CCA?
Not about that, no.
Next, we have the CCS. And the CCS is the certified coding specialists. And coding specialists are skilled in classifying medical data from patient records, often in a hospital setting, but also in a variety of other healthcare settings. The CCS credential demonstrates a practitioner's skills in data quality and accuracy, as well as mastery of coding proficiency. The CCS certification is a natural progression for professionals experienced in coding inpatient and outpatient records. Coding specialists create coded data used by hospitals and medical providers to obtain reimbursement from insurance companies or government programs such as Medicare and Medicaid. Researchers and public health officials also use this data to monitor patterns and explore new interventions. The CCSs reviews patients' records and assign numeric codes for each diagnosis and procedure, possess expertise in ICD-10-CM, ICD-10-PCS, and CPT coding systems, and are versed in medical terminology, disease processes, and pharmacology concepts. Eligibility requirements. While not required, one of the following are recommended to sit for the CCS exam. Complete courses in all of the following topics: anatomy and physiology, pathophysiology, pharmacology, medical terminology, reimbursement methodology, intermediate or advanced ICD diagnostic coding and procedural coding, and medical services, CPT and HCPCS, plus 1 year of coding experience directly applying codes, or a minimum of 2 years of related coding experience directly applying codes, or hold the CCA credential plus 1 year of coding experience directly applying codes, or hold a coding credential from another certifying organization plus 1 year of coding experience directly applying codes, or hold a CCSP, RHIT, or RHIA credential. I think we talked about this last week, the coding rates, pass rate, and first time testers. Again, in 2023, 3,287 first time testers with a 64% pass rate. Again, this is a timed exam. Candidates have 4 hours to complete the exam, and the total number of questions on the exam range from 115 and 140 total items. The exam consists of 2 sections, a multiple choice section and a medical scenario section, which is inpatient, outpatient, and emergency department, that contains multiple choice, multiple response items. And this exam is also given in a computer-based format. The exam contains a variety of questions or item types that require you to use your knowledge, skills, and or experience to select the best answer. Each exam includes scored questions and pre-test questions randomly distributed throughout the exam. The pre-test questions are not counted in the final results, and the passing score for the CCS is 300. Mr. Jesse?
For years, if you wanted to work inpatient, that was the only credential you could get, because it's the only exam that tests you on the PCS code set. And I guess for a hospital and for a coder, it makes sense because as a coder in a hospital, you can do inpatient, but you can also do observation and emergency room cases, which use the CPT and HCPCS code sets. So it makes sense from that standpoint, but now when we get to AAPC, now they have a rival that might be a little easier path, especially if you know exactly where you want to work.
And that's the key, is knowing, you know, what type of coding do you want to do, and where do you want to work.
Yeah.
Um, Next is the CCSP, and that's Certified Coding Specialist Physician Based. The coding specialist physician based professionals perform coding in physician offices, group practices, multi specialty clinics, or specialty centers. The CCSP certification exam assesses mastery level proficiency in coding of health services delivery beyond the hospital setting. CCSPs review patient records and assign numeric codes for each diagnosis and procedure, possess in-depth knowledge of the CPT coding system and familiarity with ICD-10-CM and HCPCS Level 2 coding systems, are experts in health information documentation, data integrity and quality, and play a critical role in a health provider's business operations, often as liaison to insurance companies or the government for expense reimbursement. Eligibility requirements, again, while not required, one of the following are recommended to sit for the CCSP examination. Complete courses in all of the following topics: A&P, pathophysiology, pharmacology, medical terminology, reimbursement methodology, intermediate or advanced ICD diagnostic coding, and procedural coding and medical services, CPT or HCPCS, plus 1 year of coding experience directly applying codes, or a minimum of 2 years of related coding experience directly applying codes, or hold the CCA credential plus 1 year of coding experience directly applying codes, or hold a coding credential from another certifying organization plus 1 year of coding experience directly applying codes, or hold a CCS, RHIT, or RHIA credential. Um, la, 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 la. Here are some information regarding first-time testers and pass rates. In 2023, there were 314 first-time testers of the CCSP, with a pass rate of 38%. That is abysmal. 38%, which is kind of on point with what happened in previous years. In 2022 it was 35%, and in 2021 it was 42%. This is also a timed exam. Candidates have 4 hours to complete the exam, and the total number of questions range between 97 and 121 total items. The exam also consists of two sections: a multiple choice section and a medical scenario section, which is evaluation and management, surgery, and medicine, that contains multiple choice, multiple response items. The exam is given in a computer based format. The passing score for the CCSP is set at 300, as are all AHIMA exams and programs. All righty.
I find that pass rate to be very, very interesting because I have my CCS and my CCSP, and I found the CCSP to be way easier than the CCS. Like I didn't struggle at all with the CCSP exam, but the CCS, it gave me a run for my money.
No, I too also have the CCSP, only because I was in that realm and I wanted a coding. Well, I started with the RHIT, but then I wanted a coding certification, since I was already into all things AHIMA, went through the schools and programs and all of the things. And so I said, well, since I'm already out here in these physician streets, that's what made me get my CCSP. And I agree. Again, I think, well, you don't have a lot of people, but coming out of, um, I'll just say this, coming out of at the time, I don't know now, well, now they have some programs that are direct, like coding certifications or coding diploma programs or whatever, that are CCHM approved. There wasn't a lot on CPT. I mean, you might have one class and that was it. And good luck. I know because it's physician based, there were more questions involving CPT related items than on the CCS, of course. But I don't know. I didn't think that there was enough material or enough training or education at the time around CPT for those who were sitting for the CCSP. I don't know what their, because I haven't looked at it in years. I don't know what their if they have like a prep manual or prep book or whatever. I just know, you know, even for my class, I do CPT. We go through CPT, so you're prepared for any section. And I think, you know, just there's a lot of information in that book, and you know, if a person doesn't have the grasp of how to navigate it, I think that can be probably some of the reason for these low first time tester pass rates. Hopefully, it looks better on the second try, but I think it's this real low. And I was surprised at just the number of test takers, period. But this to me is in a direct competition with AAPC, CBC. So,
But and to to that point, Clarice, when it comes to outpatient, CPC is king. And I can speak personally. I when I before I started working inpatient, I had a hard time getting some outpatient jobs because they specifically said you had to have a CPC and they weren't substituted.
right.
So that and I this whole pass rate is not it's not indicative of the person. I think that it is an indictment of the programs.
I agree. That's
Come,
what and I didn't mean to apply that if I
no,
took
no,
it
no,
down
no.
that way. Yeah.
Because what people have to understand point blank period, coding, you will not understand and you will not master coding regardless of the code set or the credential until you understand the guidelines, point blank. That's
Exactly.
it.
You are totally correct. Totally correct. You are right. Um, yeah, and well, we'll get to that too. We'll get to that too. Because you said something that I wanted to touch on. We'll get to that when we talk about AAPC. Hopefully, I'll remember. Okay, RHIT is a registered health information technician. While most RHITs work in hospitals, they are also found in other healthcare settings, including office based physician practices, nursing homes, home health agencies, mental health facilities, and public health agencies. RHITs may also be employed in any organization that uses patient data or health information, such as pharmaceutical companies, law and insurance firms, and health product vendors. RHITs ensure the quality of medical health records by verifying their completeness, accuracy, and proper entry into computer systems. They use computer applications to assemble and analyze patient data for the purpose of improving patient care or controlling costs. Participating in release and access of information by authorized entities and patients, often specialized in coding diagnoses and procedures in patient records for reimbursement and research. Additional roles for RHITs may include cancer registrar, tumor registrar, stroke registrar, etc., compiling and maintaining data on patients. The eligibility requirements. Candidates must meet one of the following eligibility requirements to sit for the RHIT examination. Successfully complete the academic requirements at an associate degree level of a health information management program accredited by the Commission on Accreditation for Health Informatics and Information Management Education, or CAHIM, or graduate from an health information management program approved by a foreign association with which AHIMA has a reciprocity agreement. Since AHIMA is launching an optional exam prep course later in 2023, I don't know if that has popped up yet, that will help to boost your confidence on exam day. Get notified when the prep course is available by filling out this form. And it tells you how to get your eligibility for testing, because you have to go through the school, and the school has to pretty much sign off, and there are transcripts and all of the things that must occur. For first-time test takers are 1,577 with a pass rate of 84% in 2023. In 2022, it was 71% with 17,009 first-time testers, and in 2021, 1,801 first-time testers with a 69% pass rate. This is also a timed exam. Candidates have 3.5 hours to complete this exam. The total number of questions on the exam is 150. There are 130 scored items and 20 pretest items, and this exam is also given in a computer-based format. The AHIMA exams contain a variety of question or item types that require you to use your knowledge, skills, and or experience to select the best answer. Each exam includes scored questions and pretest questions randomly distributed throughout the exam. The pretest questions are for data collection purposes only, and they do not count towards the candidate's score. Again, it's a 300 point passing score for the RHIT. Any questions or comments on that one?
No.
No? Okay. And usually that's when folks enter into, if they're not going for a specific maybe coding certification or a specific health information certification, and they're wanting to get kind of the general everything health information. I know when I'm about to date myself, back in the day when I got my RHIT, it was everything. It was everything in health information. Anything that you could possibly do, you learned how to do from top to bottom in the program. So I'm sure it's some of the same type of thing. So it's not focused on coding while you learn coding and you learn what it is and all of those things. It was not necessarily about coding. It was a general health information program. Next, you have the RHIA, which is Registered Health Information Administrator. So RHIAs are a critical link between care providers, payers, and patients. The RHIA has a comprehensive knowledge of medical, administrative, ethical, and legal requirements and standards related to healthcare delivery and privacy of protected patient information. RHIAs work in multiple settings in the healthcare industry, including hospitals, multi-specialty clinics, and physician practices, long-term care, mental health, and other ambulatory care settings. And they can also work in non-patient care settings, such as managed care and insurance companies, software vendors, consulting services, government agencies, education, and pharmaceutical companies. RHIAs manage people and operational units and participate in administrative committees and prepare budgets. Interact with all levels of an organization, clinical, financial, administrative, and information systems that employ patient data in decision-making and everyday operations. Manage patient health information and medical records, administer computer information systems, collect and analyze patient data, and use classification systems and medical terminologies. Eligibility requirements. Before applying to take the RHIA exam, you must meet one of the following eligibility requirements, which is successfully complete the baccalaureate level academic requirements of a health information management program accredited by the Commission on Accreditation for Health Informatics or Information Management Education, or successfully complete the master's level academic requirements of an HIM program accredited by CAHIM, or successfully complete the academic requirements of an HIM certificate of the degree, which is a post-baccalaureate program approved by CAHIM, or graduate from an HIM approved program or program approved by a foreign association with which AHIMA has a reciprocity agreement. Um, Again, to apply, there's transcripts and things through the college and all of those things that you need to know. Um, oh, I didn't even look at this part. There are 13,865 certified RHI professionals in 2023, 760 first timers at a 64% first time pass rate. 2022, 918 with a 58%, and 2021, 1,103 first time testers with a 59%. This is also timed 3.5 hours, 150 questions, 130 of them are scored, and 20 pre-tests, and it's given in a computer format. And just like all the other ones, passing score is 300. Mr. Jesse?
No comment.
Notes. And this too also provides I mean we're not going through all the domains, but this one also provides more management skills, more oversight of data, working with understanding how to kind of be the liaison for the health information department and other departments within a facility, a health system, etc. So yeah, it kind of there's a lot of law, there's a lot of compliance. All of those things are part of the RHIA.
The only thing I would want to, mention is I think that a lot of people don't realize is that like you had touched on it, RHIT and RHIA credentials are not coding credentials.
Correct.
And a lot of I don't there are a lot of people out there who really don't know the difference, that those are not coding credentials, because to when you sit for your RHIT and RHIA exams, you don't take any books with you. But for your coding credentials, like your CCA, your CCS, and your CCSP, you have to bring several because they are coding exams.
Correct. But and again, you get some. I won't say that. I don't remember in my RHIA. I think it was a broad stroke of coding. There was more coding in RHIT than there was in RHIA. But I mean, oftentimes people will you you have some people who go straight into um, a 4-year university to get their health information degree. Oftentimes people do the steps, so they'll do their associates and then they'll go and complete and get their bachelor's. In those cases, they do have a better uh, concept and understanding of coding, coding terms, coding methodologies. They have and reimbursement methodologies. They have better concepts of related to that. If you go straight through, I mean, if you start at you know going into a university at the 4 years, you don't necessarily get all of that coming in, and so it's real broad. It's real light. But there are other things that you get because basically this is a management kind of credential. It kind of sets you apart. The coding credentials are more skill based, and you are exhibiting your ability or not and or knowledge of the skill. And again, as we always say, understanding the guidelines related to that skill. So these are not. That's why there's not a whole lot of coding involved with them.
And I also wanted to mention really quickly, as I know we have some other stuff to cover, but I had during the pandemic, I looked into getting my RHIT, and I had contacted like a local community college, and what I don't like these programs. So long story short, I ended up not doing it because I didn't want to. You can only challenge a certain number of classes, and if you challenge too many, you still don't qualify for at this particular school for a degree because you had to take a certain number of credits in the in the school and then also in that department. And it's
Mm,
like they don't, I mean, and I understand that not everybody's going to come along with my background, but there needs to be some kind of consideration given, because then it becomes a money grab. Like, do you really want to educate people, or are you trying to make money?
mm.
And it just became they're just trying to make money. And I just couldn't see having to sit through something that that I do every day, and I could probably teach the class, that I have to sit through just to get this. So I was like, screw it.
Okay. CDIP is Certified Documentation Integrity Practitioner. Organizations value clinical documentation integrity competencies in health information professionals, nurses, and physicians. Individuals earning the CDIP credential demonstrates expertise in clinical documentation within patient health records. Both employers and colleagues view CDIP holders as role models within the broader health information community. Um, this is giving information about how they can take the exam, eligibility requirements. Candidates must meet one of the following eligibility requirements to sit for the CDIP exam: hold an associate's degree or higher, or hold a CCS, CCSP, RHIT, or RHIA credential. While not required, the following are recommended: a minimum of 2 years of clinical documentation integrity experience, associate's degree or higher in a healthcare or allied healthcare discipline, completion of coursework in the following topics: medical terminology, human anatomy and physiology, pathology, and pharmacology. Um, Telling you how to be prepared. As of 12/31/2023, there were 2,469 certified CDIP professionals. In 2023, 412 folks were first-time testers, and their pass rate was at 65%. 2022, 334 with 63% first-time pass rate. And 2021, 303 first-time test takers with a 62% pass rate. This is also timed, 3 hours to complete, 140 questions, 106 are scored, and 34 pre-test items, and the exam is given in a computer-based format. Again, passing score is 300. You're looking at your knowledge, skills, and or experience to select the best answer. La 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 la. Okay, Mr. Jesse.
I also have this credential, and anybody who has been a part of the Saturday morning tea, they know how I feel about the training materials for this exam. And also, they changed the name of the certification, because before it was clinical documentation improvement practitioner.
Mm,
Now they've changed it to certified documentation integrity practitioner.
mm. And we're waiting, of course, to see how this is going to shake out with the
Access, yeah, and the CCDS.
yes, yes. Okay, let's see. Um, CHDA, Certified Health Data Analyst. Individual who earns the CHDA designation will achieve recognition of their expertise in health data analysis and validation of their mastery of this domain. This certification provides practitioners with the knowledge to acquire, manage, analyze, interpret, and transform data into accurate, consistent, and timely information while balancing the big picture strategic vision with day-to-day details. CHDA credentialed professionals exhibit broad organizational knowledge and the ability to communicate with individuals and groups at multiple levels, both internal and external. Requirements: one of the following: hold an RHIT or RHIA credential or bachelor's degree or higher from an accredited college or university. While not required, the following are recommended: minimum of 3 years of healthcare data experience, experience in data acquisition, data analysis, data management, data interpretation and reporting, and data governance. There are, as of 12/31, 321 certified CHDA professionals. In 2023, 54 folks were first-time testers at a 48% pass rate on the first time. 2022, there were 38 at a 50%. And 2021, 77 first-timers at a 14% pass rate. That is horrible. Ooh,
Yep.
child. This is also timed 3.5 hours to complete. Number of questions 130, between 130 and 160. It's given in a computer-based format. Again, passing score is 300, etc., etc. They're changing exam content and format in this area as well,
Yep.
starting in February. So yeah, hey, we need to do a crosswalk on that one. Well, I don't know too many CHDAs, but yeah, if folks are interested, we can do that as well. Any comments on this one?
That one is more like a broad. It's about, it gets a lot into like statistics, but it's really not about like day to day nuts and bolts, like using Excel, and it's a very high level um, process exam. So maybe part of this revision will be a little more practical and a little more like day to day hands on type of thing, other than besides just talking about statistics and things like that.
Mm. And last is the Certified in Healthcare Privacy and Security, or CHPS. So individuals who earn the CHPS designation will achieve recognition of their expertise in designing, implementing, and administering privacy and security protection programs in all types of healthcare organizations. Holders demonstrate advanced knowledge of the privacy and security dimensions of HIM to include best management practices. Candidates requirements: high school or GED with a minimum of 6 years of experience in healthcare privacy or security, or associate's degree in a relevant field, and a minimum of 4 years of experience in healthcare privacy or security, or CCA or CCS or CCSP or RHIT, and a minimum of 4 years of experience. A baccalaureate degree in a relevant field and a minimum of 2 years of experience. RHIA and a minimum of 2 years of experience. Master's degree or higher in a relevant field, and a minimum of 1 year of experience in healthcare privacy or security. There are 666 certified CHPS professionals as of 12/31. In 2023, 83 first-time testers with a 72% first-time pass rate. 2022, 135 with a 59% pass rate, and 2021, 71 with a 46% pass rate. Timed 3.5 hours, 150 questions, 125 scored, 25 pre-tests, and of course the 300 passing score for the HPS. Questions on this one?
I think that somebody could use this credential as an entry into healthcare cybersecurity.
Mm-hmm. Yep. Oh, I didn't set the cookies. All right. So let's get on with the get on. AAPC. So AAPC came into the field and dominated the professional side. And it was more or less, so you mentioned AAPC credentials, specifically the CPC for outpatient, but it was designed for physician. They had an outpatient credential. And then they had an inpatient credential. So it's professional for all things physician, and then outpatient for all things outpatient services, and then inpatient for all things inpatient services. I think folks just combine them together, but they were standalone for professional services by physicians or non-physician providers. Anyway, the Certified Professional Coder, or CPC, is the gold standard for medical coding in a physician office setting. The CPC certification exam tests the competencies required to perform the job of a professional coder who specializes in coding for services performed by physicians and non-physician providers. Individuals who earn the CPC credential have proven expertise in physician, non-physician provider documentation, review, abstract, professional provider encounters, coding proficiency with CPT HCPCS Level 2, ICD-10-CM, and compliance and regulatory compliance for physician services. 100-question format, live proctor or computer testing. It is time for 4 hours to complete. Gives information on the equipment requirement. Training requires a high level knowledge of medical terminology, anatomy, and pathophysiology. If you don't have medical experience or working knowledge of these subjects, they offer courses, blah, blah, blah. The certification exam will test your understanding of the proper application of CPT procedure codes, HCPCS Level 2 procedure and supply codes, and ICD-10-CM diagnosis codes. These are the books that you need to have. They give you some guidance as it relates to what books, current yearbooks, etc., and how to maintain your certification. It says 80% of AAPC students pass on the first attempt. Students who train with AAPC, blah, blah, blah. Okay. Mr. Jesse.
I don't know if I believe that last part.
I don't believe that at all. We got too many folks, but yeah. The receipts are not receipting. They tried it though.
Exactly.
They tried it. Okay. Let's see. The other. This wasn't a nice, cute, neat thing like the other one. So this was the certified outpatient coder or COC certification. With some physicians choosing to join hospital groups over private practices, the need for certified outpatient coders continues to escalate, making COC certification a smart career move. A COC certification demonstrates your mastery of outpatient hospital coding, including working knowledge of ambulatory payment classifications, payment status indicators, and Medicare severity diagnosis related groups. Coders who earn their COC credential go on to report outpatient services in a variety of settings, such as hospital emergency departments, outpatient hospital clinics, outpatient therapy departments, outpatient cancer centers, dialysis services, outpatient radiology department, and ambulatory surgery centers. The requirements, I think, are the same. Yeah, everything is pretty much the same. I think this is just a standalone thing here.
I have a comment. See, I'm not impressed with this AAPC information, because if you continue to scroll up, it says it talks about MSDRGs. How can you use an MSDRG if you're only outpatient? MSDRGs are only inpatient, and also when they talk about the book, you only use MSDRGs if it's a PCS procedure, not a CPT procedure. So I don't know what AAPC is talking about, but this is low key false. Well, you know, it's false information.
Yeah, because they don't mention anything regarding ICD-10 PCS. Okay, low key false information. All right.
Mm-hmm.
Let's see. The inpatient coder. Certified Inpatient Coder Certification, or CIC. This credential is the only certification exclusively specialized in hospital and facility inpatient coding. This certification validates mastery in abstracting information from the medical record of ICD-10-CM and ICD-10 PCS coding. It also represents expert knowledge of Medicare severity diagnosis related groups and the inpatient prospective payment system. Inpatient coding differs from physician-based coding in that it focuses on services provided by the facility rather than on services provided by the physician. Passing the CIC exam qualifies you to work in the rapidly changing medical coding and billing environment of hospital inpatient facilities. CIC certified professionals typically work in hospitals, acute care facilities, skilled nursing facilities, critical access hospitals, teaching hospitals, inpatient rehab facilities, and long-term care hospitals. 40 multiple choice questions and 7 inpatient cases with fill in the blank questions, which are proctored. 4 hours to complete the exam. The CIC examination consists of questions regarding the correct application of ICD-10 PCS procedure codes and ICD-10 CM diagnosis codes used for coding and billing inpatient facilities/hospital services to insurance companies. You will need your ICD-10 CM and ICD-10 PCS book. No other code books or references are allowed. Yeah.
Let's see.
Comments on that?
Yeah, I'm getting ready to call out this 80% because how can
I think that's just a standard line because it's the same
yeah,
across all of them.
but
I think they need to be a little more transparent because that ain't the jam.
exactly. But I just wanted to say that I think that I know that imitation is the sincerest form of flattery because their exam format is straight from AHIMA.
Mm-hmm.
Because prior to them having this exam, they never had independent cases you had to code because on the CCS, I don't know about the CCA, but I know on the CCSP and the CCS, you have 8 cases that you have to code in addition to the multiple choice questions.
Mm-hmm.
So, and I actually have gotten the study guide and the practice test for the CIC, and I actually believe it is a very, very good exam. And it tests you on exactly what it says it's going to test you on. And it's pretty good.
All right. I don't know what else I want to look at. So we have the certified risk adjustment coder. We have
That was my first credential, by the way.
CRC.
Yep.
Okay. If you were in the billing space, there's a whole certified professional biller. If you're both, they have a dual certification because remember, billing and coding are not the same. They're 2 separate careers.
And
2 separate
anybody
paths.
who is serious about the revenue cycle, like I definitely recommend that you get a core coding credential and a billing credential because that billing exam is it it's a lot.
You have the certified professional medical auditor, the certified physician practice manager. So if you're into practice management, the certified professional compliance officer. I don't know about that. Okay. Core plus coding. I don't know what that means. Okay. Certified documentation expert outpatient, certified documentation expert inpatient. Is this like your CDI?
Yes.
Oh, let's look at them. Certified evaluation and management coder, etc. So let's look at this one here. Also, you got one for inpatient and one for outpatient. Let's take a look. Certified documentation expert inpatient certification. This credential validates expertise in reviewing inpatient documentation for accuracy to support coding and clinical requirements. CDEI professionals provide feedback to providers to improve clinical documentation and facilitate ongoing documentation improvement to meet our requirements of the medical record. To become a CDEI, documentation professionals must demonstrate knowledge of pathophysiology, inpatient coding, and billing guidelines, and healthcare payment models. 100 multiple choice questions, 4 hours, 2 years of experience are required. Can be a combination of medical experience and scribe experience. ICD-10 CM and ICD-10 PCS are your books. And yeah, there you go. I don't, I'm trying to think. I don't,
Exactly.
I couldn't even get it out. I don't think I usually see this one in the job description. So I don't.
And you, because you don't,
Okay. Don't waste your money.
you know what I know.
Hold on to your coins. Hold on to your coins, or go
Right.
to another a certain
Exactly.
organization.
Look, as they say, look, allocate those resources elsewhere.
Yes, yes. Here you go with new sage. I love it. Um, Only because I'm curious. This here. Okay. Certified Professional Compliance Officer. Certified Professional Compliance Officer credential addresses the ever growing compliance requirements of government laws, regulations, rules, and guidelines. Medical practices need staff who can develop, organize, manage, and direct the functions of a compliance department. By passing the CPCO exam, employers recognize you possess an understanding of the key requirements necessary to effectively develop, implement, and monitor a healthcare compliance program for your practice based on governmental regulatory guidelines, including internal compliance reviews, audits, risk assessments, and staff education and training. 100 multiple choice questions, uh, 4 hours to complete. An understanding of a wide variety of compliance topics and issues. CPCO candidates should undertake training and or have 2 years of experience working with compliance programs. Prior to the CPOCO exam, you should be extremely familiar with key elements required for compliance programs, including daily operational aspects. You should also be familiar with key laws and regulations impacting compliance programs, physician practices, and policies used to address potential fraud and abuse, including associated penalties and fines. Additionally, you should know where to go and how to research information to identify correct practices to mitigate compliance risks. Be aware that this is a challenging high level examination which is not meant for individuals with limited or no compliance experience or training. You don't have compliance experience, okay, blah, blah, blah. No physical references are allowed. All necessary materials are available within the exam platform. Mm-hmm. Yeah. Don't waste your money. The CHC is your jam. The Healthcare Compliance Association is your jam. Alrighty. Okay. Well, that's it. That was the alphabet soup. I've gone over time a little bit. That was the alphabet soup of all of these. Hopefully, this gave you some additional information or some food for thought on where you may want to land as it relates to a health information credential. Again, AAPC has a slew more alphabet. I just wanted to primarily focus on the coding ones, and those other health information credentials that we kind of talk about or deal with on our program. Mr.
And
Jesse.
I just wanted to say, more importantly, I just people need to know exactly what it is you want to do. Because
Mm-hmm.
as you can see, covering these two organizations, there's some overlap and then there's some distinct difference.
Mm-hmm.
And for me, like I used my first of all, you go by what the market is requiring for
Mm-hmm.
whatever it is you want to do. Now you can go ahead and try to, go swim upstream if you want, but if you like, because what I did was I used AHIMA for my core credentials, and almost, well, not almost every AAPC credential I have is a specialty credential. The CRC, the CPMA, the CPB. So those are specialty.
Mm-hmm.
And when it came to CDIP, I picked that over Actis because I couldn't qualify for the Actis but I qualified for the CDIP. So
Mm.
that's the one I went for.
Mm.
And both of them are recognized in the industry.
Mm-hmm. I don't know about this other one.
Exactly.
Once upon a time in AAPC history, you had to have your CPC as the core credential before you can do any specialties. So you had to pass that exam first and foremost. Um, and then they loosened it a little bit where, okay, you had to either pass the CPC or the CIC or the COC, and then you can do a specialty. Well, then they don't relax it all the way, and you can just go into wherever it is that you want to go in. Again, be prepared. Be prepared.
Les, the only thing I wish is I wish that AAPC would drop this apprentice nonsense, because the CPC,
It's the same test. It's the same exam.
These core exams are not easy.
No.
And they tell
you, they were real transparent about their passage rate, this 80%
right,
foolishness.
exactly.
No.
And they tell you in their literature that these are mastery level certifications. So if you are at a master level, why you still got to work for 2 years and get your before you have your A removed? That's why I didn't get my CPC. That's why I went and got my CCSP. Even though I had worked, I worked as a coder for like 2 years, actually 3, because I started in 2014. I got my CRC in 2017. I didn't trust my company to give me a letter afterwards so I could have I was like, I'm not walking around with no A in case things go left. So that's why I got my CCSP.
Well, all you had to do was have your job description and send that information, and however long you had to be there as well. It was ways around that letter.
Well, thank God I didn't have to go through it.
You didn't. Benita says, thanks, very detailed to assist in determining what areas you may want to put your coins in. Exactly. That was the primary purpose of today, just to do a walkthrough to get a better understanding of what this alphabet soup looks like. I mean, because there's a whole bunch of stuff out here. And we all know there's some other organizations. These are the main two. If you're going to focus anywhere and play around with the, as Mr. Jesse like to say, the church's money, play in these 2 areas, except for compliance, HCCA. You need to add that today. But that's a whole separate conversation. Because this stuff, woo, child. But anyway, that's my tea for the day. But yeah, so there's some other organizations out here. Yeah, they fooling. And don't get me wrong. I only want to swat them down because they trying. They're trying to make a name for it. And eventually, I guess they'll get there. But today, if you're looking for jobs today, don't play. Don't play. All right. Well, this was good.
Yep.
Good. We got what we needed. Said what we had to do. All the good things. All right. Well, thank you all again for joining the Saturday morning tea or checking out the replay. Don't forget, if you are part of our wonderful Patreon, we got a lot. We probably gonna still discuss some of these certifications in the meeting after the meeting, because some of this is some foolishness, but we keeping it above board.
Yes.
For your listening purposes.
Not easy, but we holding on.
We holding on. We gonna unleash and piping hot tea, straight no chaser, gonna happen in the meeting after the meeting. So join us. Check out the description box so you can get more information about how to be part of our Patreon and join the meeting after the meeting. Again, was the tea spilled today? Preferably it was. There is some information here. And if this information was valuable for you, help us share this message with others by sharing the video and subscribing to the channel. Be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. And as you leave out, don't forget to hit the thumbs up or like button. Also, check out the Coding Nurse channel on YouTube. So this has been a great session today. Thank you all for joining. And remember, Mr. Jesse, did you have any final words?
No.
Okay. Well, remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and we will see you later.